Hello, it's September the 10th, 2009. This is Ed Hamler with your evening report. Lyndon LaRouche laid out strategically, from the top down, the nature of the enemy that stands in the way for not only a world economic recovery, but a successful future over the next generations ahead. He said, "The world has to face the fact that the British monarchy contains the greatest concentration of genuine evil, whose effects is the greatest source of evil on the planet today. The clearest case to understand this today is to expose the British genocide operation called healthcare reform and their attempt to export that to the United States." Here's the expose. The royal family and the City of London financiers began implementing in 2008 a new program to kill elderly and other sick people, precisely repeating the opening phase of Hitler's 1939 T4 euthanasia program. Under the Liverpool Care Pathway, adopted for general use by the National Health Service, those showing that symptoms that might foreshadow death are immediately killed by heavy narcotics and the withdrawal of fluids and nutrition. The new policy reportedly accounted for about 1/6 of all deaths in Britain last year. Now, how did this begin? The King's Fund is the official agency driving the new euthanasia in Britain as well as in the United States. A government-funded charity called the Marie Curie Cancer Care, or Marie Curie Hospice, is the operations center tasked with shaping the killing program. Al Gore's soulmate, Prince Charles, has been the president of the King's Fund since 1986 and the president of the Marie Curie Hospice organization since about 2000. What is today called the King's Fund was created in the late 19th century by the scum who orchestrated World War I, the Prince of Wales, Edward Albert. After he became King Edward VII, the agency was incorporated in 1907 as King Edward's Hospital Fund for London. This was the royal family's planning center for the reform of healthcare in accord with the empire's innovation of the time, eugenics, or race purification theory. To start up the new killing program in 2008, the Queen became the patron. The agency was reincorporated under the shorter name King's Fund, and Prince Charles and his retainers went into overdrive. The King's Fund and the Marie Curie Hospice were merged for action with the June 24, 2008 announcement that King's Fund Policy and Development Director Steve Dewar would simultaneously lead two agencies to develop contribution of both organizations to the further improvement of end-of-life services across the UK. In July 2008, the National Health Service published its end-of-life care strategy, developed by an NHS strategy unit set up for the new euthanasia program. The Marie Curie Palliative Care Institute in Liverpool is one of two centers for experimental killing regimes. Out of this has come the procedure called the Liverpool Care Pathway, with its continuous deep sedation, which has recently broken into headlines in Britain due to a public protest against murders by physicians. In the above-mentioned National Strategy Report, the end-of-life care pathway starts with Step 1, identifying people who are approaching the end of life. It proceeds to Step 5, last days of life, in which the Liverpool care pathway is the means of termination. After this comes Step 6, care after death, or what to do with the bodies and the survivors, and it proposes methods for falsifying death certificates to show a natural cause of death rather than homicide. This is precisely to the T what was done in the Hitler T4 program. If you don't believe me, just take a look at the Nuremberg trials for yourself. A National Health Service Commission report by McKinsey & Company calling for saving $32 billion per year by drastic cuts in healthcare was leaked to the press last week. King's Fund chief economist John Appleby responded that these savings must be accomplished by finding ways to counter rising healthcare costs associated with an aging population, expensive new medical treatments like cancer treatments, and rising patient expectations. King's Fund Chief Executive Niall Dixon chimed in that rather than doing more with less resources, doing less with less seems a more realistic scenario. Now, how was this exported to the United States? The Royal Euthanasia Program was introduced as a pilot project in 2003 and 2004 by Simon Stevens, Blair's Chief Healthcare Policy Reform Director. This was around the same time that the murderous National Institute for Clinical Excellence, NICE, was set up as well under the NHS. When Blair resigned as Prime Minister in 2007, Stevens went to the United States to spread the euthanasia project here. Stevens became Vice President of Minnesota-based United Health, the massive private health insurance company for the United States and Britain. Stevens' official job now is to advise all private health insurers to get behind the new agenda for Obama's healthcare reform, and to this day, Stevens is a trustee of the King's Fund for Prince Charles in London. So when LaRouche had the guts to attach the toothbrush Hitler mustache to Obama in the summer of this year, he did the population and Obama himself the biggest favor ever by letting us and Obama know that he's nothing but a narcissistic British tool, as Hitler was. So this is what we have to stop now. So there should be no equivocation. Barack Obama is carrying the same basket of Zyklon B that the British handed to Hitler in 1939. And he still, after the population said no this past August, he's still psychotically determined to get his way in ramming through this British-authored Nazi policy. Obama, starting with the joint session speech last night, has gone flight forward to crack heads of all who oppose. For example, the moderate Democrats voiced their opposition in support of the bill as they arrived in Washington, D.C. earlier this week. Today, the White House, being the fascist bullies that they are, hauled in all members of Congress who considered themselves moderate Democrats to meet with them in order to twist their arms until they scream uncle. Democratic members of the Progressive Caucus also announced that they intend to oppose Barack Obama's bill. And surely enough, we can expect the Nazis within the administration to deal with them very soon. It's clear then, as soon as the recess was over, these were the actions taken by the president, actions that only a fascist dictator will conduct. Obama willfully ignores the will of the American people, as was heard throughout the country in August. American citizens mean nothing to Barack Obama. Only Barack Obama means something to Barack Obama, and he's willing to accomplish a mass murder that will make Hitler blush in order to feed his inflated ego. But his insane measures don't stop there. Obama's boy in the Senate, Max Baucus, plans to have a bill ready by Monday, with hearings starting the following day. They even plan to bring in a team of dummies called experts as ammunition to ram this thing through. As reported, the intention is to have it marked up by the 21st of this month. So the president is a mindless nut. What else is new? As the days go by, the reality of the current economic crash will drive what will have to be discussed. Don't worry about the new figures coming out about the ease of the economy. These are all lies. There are no jobs out there. Healthcare is virtually extinct. Youth of today have no future. The reality is that we are on a one-way track into a planetary-wide dark age. All American patriots out there, such as those of the mass strike that we saw in August, know that there is something extremely wrong when they caught the smell that the president is trying to kill them. They will not accept that. That is where LaRouche comes in. Because right now, the people are revolting in an angry but currently reasonable fashion. But as the situation gets far worse and desperate, it will get more desperate very rapidly. They will very likely go to lengths that will not be controllable. LaRouche laid out very directly in his recent webcast what needs to be done, and only those measures which he has laid out will work. So, Mr. President, that is your choice. Take LaRouche's advice and accept the fact that you don't really know what you're doing. and we can begin to take serious measures to regain the confidence of our people. If you refuse that offer, then you will also be responsible for the great chaos that is about to hit us very soon, a chaos that you can't even begin to imagine. So that's all for today. This is Ed Hamler signing off.